Good morning. Welcome, and thank you for joining us for our Northern Light Health Good Health is Good Business Zoom conference. I hope you all enjoyed a happy and healthy holiday season. 2021 proved to be a year of many challenges, and while we look at the year ahead, today we will shift our focus to supporting the health and well-being of our employees. There has been a whirlwind of information thrown at us from public health officials. We have the Omicron variant, questions about vaccine efficacy, and what feels like a persistent surge in COVID-19 cases. Today's COVID-19 update will hopefully answer many of your questions and also help us make sense of the information coming at us fast and furious. Along with the COVID-19 update, today's discussion will offer you strategies for supporting employees' mental health, wellness, and preventing employee burnout, a growing and more prevalent concern for many employers. I'm Karen Hawks, Vice President of Operations at Northern Light Beacon Health, and I'll be your moderator for the next hour. Please join me in welcoming our expert panelists today. Dr. Ed Gilkey, Senior Physician Executive for Northern Light Beacon Health, who will be providing the COVID-19 update this morning. Catherine McLaren, Vice President of Talent and Diversity for Northern Light Health. Angela Felicia, a licensed clinical social worker and the Director of Healthy Life Resources at Northern Light Acadia Hospital. And Annika Carlson, a registered dietitian and nutrition specialist for Northern Light Beacon Health. Before we get started with today's panel discussion, I will read our legal disclosure. The coronavirus pandemic is an ongoing, continuously evolving situation. Northern Light Health encourages everyone to follow federal and state governmental guidance and mandates. Northern Light Health does not know the particulars of your situation, so the information presented today is general in nature and is based upon Northern Light Health's own experience, which may or may not apply in your specific situation, and which may be revised as we learn more about the coronavirus. Accordingly, following any guidance Northern Light Health presents today in no way guarantees that you, your employees, and or your customers and clients will not contract or spread the coronavirus. This hour is intended for you, and we welcome and encourage your questions at any time using the question and answer function. Also, I hope each of you will take a few minutes immediately following this hour to answer our quick 5-question survey. Your input directly affects our topics and helps guide our future conferences. Dr. Gilkey will get us started by providing the update on COVID-19. Good morning, Dr. Gilkey.
Thanks, Karen. Good morning. Good morning, everyone. In preparing for today's session, I couldn't help but reflect on the dichotomy of the pandemic at this time. Some people wearing masks, some not. Large gatherings at sporting events while hospitalizations reach all-time highs. People in our communities behaving like they are so over this, and healthcare workers stretched to the breaking point. Delta and Omicron, behaving almost like two different viruses. It struck me. We were in a period I'll call a tale of two pandemics. Let's start by looking at daily new cases worldwide. We see 4 surges, with the Delta wave to the far right having an Omicron spike forming on top of it. This exceedingly rapid rise in cases demonstrates the very high transmission rate of Omicron. It infects unvaccinated, vaccinated, and those that have had boosters. On this next slide, we look at the new cases in the US. The far right looks the same with a massive increase due to Omicron. Based on sampling techniques, Omicron accounts for 95% or more of the new cases in the US. Omicron infects better than Delta. It is more contagious. The reasons to vaccinate and provide boosters are to lessen the severity of illness and shorten the period of infectivity. Let's look at hospitalizations. Remember that from the time of exposure to hospitalization is generally 2 weeks. Currently, we are seeing the effects of holiday gatherings. Here's where the data gets confusing. We hear reports in the US, everyone hospitalized with COVID is counted, and many of these people are in the hospital for something else and incidentally have COVID. The epidemiologists are beginning to demonstrate that there is considerable variation across counties in the US. There are higher rates of hospitalizations and severe illness in counties with lower vaccination rates. We hear Omicron causes less severe illness. The original data came from South Africa, where immunity is at 90% 40% due to vaccinations, and 50% from people being previously infected with COVID-19. In South Africa, their population's average age is 10 years lower than the US. The United Kingdom has a similar average age to the US and is also showing a lower hospitalization rate. However, because of the number of people getting infected all at once, the actual number of people hospitalized is very high in spite of the rate being low. We anticipate a similar pattern in the US. The takeaway is Omicron is very serious, causes severe illness, hospitalization, and death. People who are not vaccinated or have not previously been infected with COVID-19 are at much higher risk, as are those people who are immunocompromised and vaccinated. The critical problem now is that many people are getting infected at the same time, and the volume of people requiring hospitalization is overstretching the hospital staff. On this next slide, one of my personal favorites, we are looking at the phylogenetic tree for SARS-CoV-2. I've included it to capture the scientific complexity and the work that goes on behind the scenes that leads to public health policy. The center of the graphic is time zero, when the SARS-CoV-2 was wild type and just starting to infect people. Each of the lines emanating from this central core is a lineage of the virus, leading to mutations and the variants we've come to know. The longer the line, the longer the variant has been with us. We can see the whole history on this one slide. We can see when alpha was dominant, and we were paying attention to gamma and beta. Then delta took over, and boy did it take over. We then see this stealth lineage called Omicron, and this graphic captures the beginning of the current explosion with the red dots. I called it stealth because this lineage was actually first recognized in mid-2020, and it disappeared from human surveillance, the straight line area without any dots. Then it reappeared with 45 mutations this fall, and continues from there. The most plausible reason for becoming stealth is that it transferred to mice, then transferred back. This is called zoonotic transfer and is common for viruses. The other explanation we hear out there of ongoing mutations in a chronically immunocompromised person is a less likely explanation. As an aside, we know this virus infects dogs, cats, camels, mice, and other animals. In fact, 30% of the white-tailed deer populations in Pennsylvania, Illinois, and Michigan were found to have been infected based on the presence of specific antibodies. Through infecting mice and mutating, the virus became much more contagious and developed an affinity for the upper respiratory tract, lessening the infection of the lungs in animals or humans. For our teachers participating today, this is an example of natural selection in real time, where the mutations give the Omicron virus competitive advantages by replicating more effectively and not killing as many hosts. This is evolution compressed in time before our very eyes. And that's why I was excited about sharing that slide with all of you today. So what does this all mean for us today? It means vaccinations are the primary tool to combat severe illness and death. Boosters should be given to vaccinated people after 5 months for age 12 and above for the Pfizer vaccine. The lowered age and the shorter time since the primary vaccination series is new information. For ages 5 to 11 who are immunocompromised, a third dose in the primary series is recommended for the Pfizer vaccine. The health officials are making it a point to define this special group as needing a primary series of 3 shots. Our Northern Light Health position on boosters they are not simply an extra layer of protection, rather they are necessary to address Omicron. We are all hands on deck to get employees boosted and working with Maine CDC to make boosters available to everyone who is eligible. Since this virus is airborne, a well-fitted mask is necessary. Additionally, the mesh of the material should be healthcare quality grade and not cloth. If sick, people need to stay home. If staff are able to work remotely, employers are recommended to promote this option. For now, as sunnier skies may not be too far off. I've included the Maine State website that is an excellent source for staying up to date on symptoms, prevention, testing, quarantining, isolation, and return to work. And I think a lot of your questions probably can be answered on this site. And is truly your best source of information. These recommendations consider the behavior of the variants and are a good basis for your company policies. Finally, on this slide, I want to talk about monoclonal antibodies. Since we have entered the period of Omicron dominance, the two antibody regimens we have used to save people's lives no longer work. The mutations with Omicron see to that. Sotrovimab is the only monoclonal antibody that works against Omicron, and it is in severe short supply. The federal government distributes it to Maine, and then the demand is considered based on this limited supply. Our recent state demand was for greater than 500 treatments, and the supply was just over 100. Also, we have two oral medications to treat with, molnupiravir and Paxlovid. Both are severely limited and available by state distribution through Hannaford's and Walmart only. As physicians prescribe these medications, the state is working to align the supply. So we'll pay attention to that supply chain. Maine is following the National Institute of Health criteria to identify which patients are eligible for these very limited treatments. Essentially, the treatments will be targeted to high-risk people only, high risk for severe illness. The purpose of the depth of transparency you've heard today is to provide you and our communities with a deeper understanding of the tale of two pandemics. I'll wrap up this session with some insights into our future. We are very likely to experience a sharp, massive spike in cases like other countries around the world. A prolonged or extended wave is not likely. That's some good news. We're seeing the rising cases now. The hospitalizations will increase over the next few weeks, and the people dying from COVID will increase somewhat for a few weeks after that. March has the potential for looking better as the spike will be in the rearview mirror. What about the next variant, the next stealth virus? Omicron is so competitively effective, those scenarios are not too likely to occur. Some more good news. We have a medium chance of this variant causing a shift from the pandemic to an endemic version. That means it will likely continue to infect people, cause possibly 100,000 deaths in the US per year, about twice what we see every year with flu, and be managed with a vaccination booster program. Our take-home message is that we shouldn't underestimate this virus. Get vaccinated, get a booster, wear well-fitted, high-quality masks in indoor public spaces, stay home if sick, work remotely if possible, and take good care of one another. There are reasons to be hopeful as spring arrives. Thank you, Karen.
Thank you, Dr. Gilkey. There's so much information that you were able to condense into just a short time. So I definitely encourage our audience to use the question and answer function to ask questions. Dr. Gilkey will be coming back at the end of our formal presentations to address those questions. So please use that opportunity. At a recent Zoom conference, we asked our audience what your greatest concern was as it related to employee mental health and the impact of the pandemic. And employee burnout was number one. The Great Resignation year has been used to describe 2021. Employees have left their jobs at an historic rate, 4.5 million to be exact. So our poll question today for you: are you experiencing a higher resignation rate at your workplace when compared to pre-COVID? Please take a moment. We'll see how the audience polls. Okay, let's see what the results are. 48% of you are experiencing higher rates of resignation, and that's not surprising. I'm very happy and pleased for 31% of you who are saying no, and 21% are about the same. So I would say about half of our audience are definitely experiencing the impact of employee burnout. And so I am so pleased to welcome Catherine McLaren to today's panel, where she's going to talk more about this topic and share strategies for both recognizing and preventing employee burnout. So welcome, Catherine. Thank you so much for joining us this morning.
Thank you, Karen, and good morning, everyone. I wanted to start this discussion from an employer sort of leadership perspective, and start by sort of defining some terms. And when we think about employee burnout, essentially what it is emotional and physical exhaustion. What it looks like and shows up as in the workplace is essentially what people often describe as someone either being checked out or being off, or a combination of those things. So either they're not showing up in the way that they have in the past, or there are mistakes being made, or people are irritable. And, I would say arguably most of us have experienced some of these things at some points in our professional careers. There certainly are a lot of indicators that there's a big increase now. And then, of course, the impact, if you take a look at the graphic around the toll that burnout takes, and these are just some of the things, is significant. So it is something to certainly pay attention to. I want to talk about the 6 main causes of employee burnout in the workplace. And I think what you'll see as we go through this is that a lot of these things are also occurring in our personal lives. So the 6 main areas are overwhelming workload. So that may be unrealistic expectations. It may be conflicting priorities. It also may be a lack of leadership. In addition, having a sort of, or not having control, in the sense of not being able to inform decisions that are made for us about our work, perhaps role conflict, or not having the resources. So the close to 50% of you who have indicated that you're seeing more people leave. We know that staffing shortages across many industries are an issue right now. And so sometimes it's literally not having the staff resources to do all the work, or do the work in the way that we would prefer. The other piece can be insufficient rewards. And I want to be clear about this, that this often doesn't mean money. Sometimes people think about it that way for obvious reasons, but it can also mean recognition for the work that's been done, and also just sort of being able to focus on what's being accomplished as opposed to what isn't getting done, which can start to take a lot of energy and cause a lot of distress for people, leading to burnout. And then also as a loss of a sense of community. So that can be isolation, certainly. And then it also can be a chronic ongoing conflict, and that is not resolved, and that the person has not accepted as that's the way it is, but spends a lot of energy. I think about that as one of our kind of energy vampires. It gets a lot of attention, but it's not necessarily useful attention unless something's being done about it. And then unfair policies or decisions, and unfair, of course, is a somewhat subjective term, so that can be a reality. It also can be a perception. And that can be related to workload or promotions or flexibility or what have you. And then the sixth bucket, so to speak, is what is referred to as power stress, and that often happens for leaders, whether formal or informal. And that is the added responsibility of having, feeling very responsible for people, for the work, for everything else. And that can actually lead really strong leaders to start to not be behaving in those strong leadership ways ultimately, because there's so much stress involved with that. So as I mentioned, what's interesting about the last couple of years is that many of these items are also very prevalent in most people's personal lives. So to a certain extent, they may be happening in both primary work spheres or life spheres. So let's talk about preventing employee burnout, because there are some things that we can do sort of on the front end that can be helpful. One is just creating a dialogue for it. And I think it's this interesting and both scenario. I have spoken with people over the last couple of years who have some hesitation about talking about it because they don't want to dwell in it. And there is work that needs to be done. So what's the balance there? And there is a balance, but simply creating an environment for people to be able to talk about the fact that it is challenging, and that there are, distressors involved can make a huge difference. In addition, that balance of workload and capacity. So, having one-on-ones and checking in with people about how they're doing. I have a lot of conversations with people on my team about, you are one person and today is one day. And so we're going to prioritize, what you can get done in this day. And then, let's feel good about that because if we start to try and expand our capacity by working more and more and longer hours, ultimately that's not going to serve us as individuals and as in the organization. In addition, community. So where are the opportunities for people, the forums within your organization for people to connect, to decompress, to laugh, to recognize each other and what's going on? And I want to make a note here because I think it's really important. What we know is that when we're under stress, we tend to become very task-oriented. And this is when people who make lists make more lists, and people who have never made a list may start making lists. And we get so focused on the tasks that we stop attending so much to the people and our relationships. And unfortunately, it's those times when probably some of the relationship attendance becomes even more important. So thinking about where those opportunities exist. And then finally, in terms of fairness, being transparent about decisions, communicating the why about what's being done, and that is probably the biggest step that gets missed sometimes when organizations are moving very quickly or departments are moving very quickly. So taking a moment to check in on that can make a big difference. And then if we talk about addressing employee burnout, if you're noticing that something is going on with someone, the first thing is to not take a sort of fingers crossed approach that it will just resolve itself, hopefully. And, this is kind of uncomfortable and the person is really great and I like them and they've, they usually are, historically have been fantastic, but to just, approach it directly and appropriately. And that can be just, is everything okay? Now, there's a caveat here, and the caveat is that there are some people, and we all know who they are, who will say, yeah, it's fine. Everything's fine. Fine, fine, fine. With those folks, you may need to take a little more active approach in saying, well, I'm seeing some things that I'm concerned about you, as a person. And then the second piece is to not make assumptions. And when I mention getting to the root cause, I don't mean that I'm suggesting that we all become therapists to, the entire workforce, but that we don't want to assume that we know what the problem is and then implement a solution before we've actually had a conversation about it. Because I might notice that something's going on for one of my team members, and I might say, okay, well, I'm going to take this project away from them to give them some breathing room. Well, that might be the project that they're actually getting the most out of right now. And it might not even be about the workload. It may be that they are spinning about not getting enough work done because they're used to being very productive, and in this current environment, whatever it is, they're not feeling quite as productive. It could be a whole slew of things. So collaborating on solutions becomes really important. What are some things that might help? And when we ask that, we're not saying we're going to do those things, because there may be some things that just aren't feasible, but we're starting to have the conversation and figure out what can work. And then demonstrating compassion and empathy. So not taking it personally if people are starting to feel burnt out, and being able to acknowledge that it's hard, and then shift to how we're going to move forward. Sometimes people will stay away, and I've had these conversations around we know it's hard because they're afraid that it will, then we'll be dwelling in the drama. But when it's hard, people know it's hard. So acknowledging it goes a long way. And then modeling self-care. So this somewhat goes back to that power stress piece, which is that if you have leaders who are telling people, oh, you need to go take care of yourselves and you need to do all these things, but they're not doing it, people pay much closer attention to what we do than what we say. And this is a time to be fairly overt about what it is that I'm doing, whatever that is, to model the behavior that we're looking for. And then offering resources. So whether that's EAP or wellness or whatever else is available, all of these things can become very important. So I'm going to hand it back to Karen now. I'm happy to answer questions later, so we can take a deeper dive into wellness and self-care.
Thank you so much, Catherine. Such a wealth of information there. You certainly have me thinking. Angela, I'm so pleased to have you back, Angela Felicia, who's our next presenter. And Angela, as we reflect on what Catherine has shared this morning, I'm hoping you might be able to provide some more insight into what factors are impacting employee mental health and how we may be able to better support them.
Yeah, absolutely. And Catherine launched this discussion really nicely and gave us a really nice foundation. And I wanted to share a bit further and a bit more in depth in regards to sort of where we're at in the context of our mental health related to this disaster. And I really do think about this as a disaster, right? This has been going on nearly 2 years, and this is an extremely difficult situation for everyone. I really appreciated this particular graphic that I found because I think it articulates how we have been spending a lot of time in that disillusionment, uncertainty phase. And for some of us, depending on our experience during the pandemic, this creates a level of anxiety, greater or less, depending on the person. But for some of us, depending on what you've been through over the course of the 2 years, this might in fact have been a very traumatic event for you. In all of us, we've all experienced some sort of trauma. I'm actually using that word trauma on purpose because I think it's important to think about and talk about how these stressors that we've experienced collectively are really traumatic stressors. So these are some definitions of trauma from Substance Abuse and Mental Health Services Administration, SAMHSA. And really, trauma can be caused by any event that is experienced as physically or emotionally harmful. So it's really about that perception of the event. And trauma does cause these lasting negative effects. It can cause negative effects in our workplace, our social life, our family life, our mental life, our emotional life, and even our physical and spiritual life. Good slide. I do always like to stress that the responses that folks are having, anxiety, grief, depression, insomnia, any of those responses are 100% normal for this particularly abnormal 2-year, once in a lifetime, we hope, event that's been going on. Over time, with these normal responses, you might find yourself being more cranky, irritable, angry, maybe having outbursts when you wouldn't normally do so, maybe breaking down in tears if that's not something that's normal for you. And you might, in fact, see this in your customers or your employees. I think we've all read the headlines of some pretty wild behavior by individuals on planes or in public meetings. And frankly, much of that is a result of this overwhelming anxiety, depression, and response to trauma. Next slide. And it is important for you all as employers, employees, to really think about how that impacts both individuals, but then also in the workplace, right? So in the workplace, frankly, you might see customers being very angry, irritable, pretty unpleasant. You might even see bullying happening. These, unfortunately, are sort of that end of the continuum of that normal response to stress, anxiety, depression, and that trauma response. You know, all of these things can lead to that individual feeling just out of sorts, irritable, cranky, upset. You might even end up feeling physically unwell, having belly pains, headaches, muscle aches, tension, etc. And then, of course, these things can all lead to call-outs, absenteeism, or something called presenteeism that I've been sharing a lot with this group and in this webinar. Just that phenomenon of people showing up physically to work or virtually, depending on where you're working, and just sort of being there, but not really putting forth that best effort. All of these things can sort of spiral and lead folks to feeling worse and worse and worse. Next slide. So there are ways to help. Catherine outlined really those hallmark ways, right, of checking in with people. She highlighted where you might check in with someone and they say, oh yes, I'm feeling fine, right? That's sort of the standard answer to that question. So I wanted to share with the group today a really specific check-in model, actually developed by the DuPont Corporation and has been fully vetted by the American Psychiatric Association for use in the workplace. In fact, that's why it was developed. It's a model that's very easy to do. No one needs to be a counselor to do it. You need to have no special training. The model is called ICU. So you literally identify the signs you're seeing. Boy, Sue, I'm really noticing that you don't quite seem like yourself. You seem much more irritable than what you usually seem. I'm worried about you. So you're connecting with that person. And then that understanding, and this slide sort of gives you some of those talking points and sort of how that might start. That understanding piece is really about, boy, I want to make sure you're okay. This sounds like this is really tough for you. I want to connect you to the right resources to make sure that you're doing okay. What I particularly like about this model is it's not asking anyone to solve the problem for the person. It's simply asking people to connect on that human level, normalize the response that folks are having, and then help that person get to the appropriate service, whether it's an EAP, an app that maybe is particularly helpful, encouraging them to talk to a trusted friend or loved one. All of that can be particularly helpful in taking care of employees and ourselves.
Thank you, Angela. I think that is such a helpful tool because starting the conversation is one of the most difficult things. So having that in our toolbox, I think is so helpful.
Yeah, I agree, Karen. Thank you.
Thank you. So, as we have discussed this morning, living and working during a pandemic is causing increased stress. There's no doubt about that. 70% of businesses with more than 200 employees offer a wellness program as part of their benefits package. And studies suggest that supporting employees' health and wellness can lead to better engagement, more productivity, and higher job satisfaction. So, as we transition to our next speaker, I'd like you to ask the audience the following question: does your place of employment offer employees a wellness program or services? Okay, let's see what the poll results say. 76% of you offer wellness programs. That's fantastic. 22% are no, and 1% is I don't know, which is fine as well. And we'll work on how we can share that message across healthcare employers and help hopefully that communication chain. I really appreciate your response. That helps us level set and see where we're at as we welcome our next speaker, who's Annika Carlson, to our panel. Annika, welcome. Thank you so much. And we look forward to learning from you in the next few moments.
Thanks, Karen. Hi, everyone. So I'll be talking about the importance of self-care and going over some things that businesses who do have wellness programs and who don't have wellness programs already, what they can do to promote self-care in the workplace. So many of us have read articles or posts with some of the how-to tips on practicing self-care. But when we see the word self-care, it can be helpful to remember the true meaning behind the word itself. And self-care means exactly that, caring for oneself. Self-care is a very personal and subjective form of care, and activities can vary from person to person. There are basic forms of self-care like maintaining good hygiene, a healthy diet, regular physical activity routine, getting adequate sleep each night, and drinking enough water throughout the day. There's also other types of self-care that involve things like participating in activities or experiences, which will leave you feeling joyful and fulfilled. Spending time exploring and identifying these different activities that give you these feelings is really important part of figuring out what kind of self-care you need to do for yourself. It may include things like listening to music, getting outdoors, meditating, or even signing up for a new class that you've been wanting to try. We're all busy in this life, and it's important to, it's oftentimes we put our self-care on hold first. But the best way to avoid doing that is to set up a routine for yourself. One of these tips is to make sure that you have a list of activities that you can choose from. That way, if life does get busy and you don't have enough time to do an activity that involves a lot of time or preparation, you still have other smaller activities or ways of caring for yourself, even during those busy times in life. So why is self-care so important, and what does it actually bring to the table when it comes to the workforce? As we talked about earlier in this presentation, preventing burnout and enhancing mental well-being in and out of the workplace put employees at a much lower risk of developing certain chronic health issues due to stress. And one of the best ways employees or anyone can achieve this is by practicing self-care on a regular basis. And it's one thing to tell somebody to go and do that, but in reality, how can a full-time or even a part-time employee practice self-care in a working environment? Well, when it comes to employee health, it really does start with the employer. It's important for businesses to recognize the fact that most of their employees will spend a significant amount of their waking or daytime hours in the workplace or in front of the computer screen at their home office. So in order to maintain a healthy workforce overall, businesses should consider how they might best support the well-being of their employees by offering the time and/or resources so that employees can continue to practice self-care throughout the day and the work week. Leaders play a big role when it comes to implementing employee wellness initiatives, and these are some of the baseline principles that all leaders should adhere to. Leaders are responsible for maintaining a safe and healthy working environment for all of their employees. And this applies not only to the physical safety, but employees must also have a mentally and emotionally safe space to work in. Leaders should be up to date on the proper training and techniques on how to deal with situations surrounding any concerns, issues, or crises that an employee might be facing at any given time. Even in the safest working environments, which promote and encourage open communication, some employees may still find it difficult to initiate conversation or express certain concerns or issues. This is why it's important for leaders to regularly check in with their employees. Opening a line of communication directly with your employees shows them that you care about their well-being. Leaders should remember not to drop the proverbial ball either when it comes to dealing with employee issues. Every concern and issue should be reviewed and given equal amounts of respect when brought to the table. Leaders should consider these to be priority matter and work to resolve them as soon as possible. When an organization is offering health or wellness resources, leaders should be made fully aware and understand every resource that the company is currently offering and should be regularly promoting and encouraging the use of these resources. As we mentioned earlier, self-care is crucial to an employee's overall health and wellness, and leaders should be vocal advocates for regular self-care, inspiring others to have open conversations about this topic within the workplace. Leaders and employees should encourage one another to take part in their own self-care activities, both inside and outside of work. And as a leader, you should always be acting as a good role model as well for your employees. It's oftentimes beneficial to have leaders not only promoting and encouraging their colleagues to use their company's resources, but to have them partake or participate in these wellness and health activities alongside their colleagues. This can create a fun, inclusive, and healthy work atmosphere for all employees, and can even help to bridge the gap between employees working within the different departments. With a growing workforce and chronic illness on the rise, continued research is being conducted on the topic of employee health and wellness in the workplace. And many of these studies report data showing that businesses who do support the overall wellness of their employees can actually expect to increase their employee satisfaction rates and even stand to gain a return on their investment when they invest in wellness programs. Businesses which do offer these programs also need to ensure that they give their employees the time and opportunity to take part in them. It's the only way to measure the results and gain the full benefits of that investment. Lastly, here are a couple tips on how to start facilitating self-care in the workplace. When leaders ask employees how they're doing, try not to only ask about how their work is going that day or that week. Facilitate a conversation around self-care when you can. Get to know your employees on a deeper level by finding out what they like to do outside of work and what are the activities that bring them joy. You can send out a company-wide survey or questionnaire to find out the interests and needs of your employee population as well. This type of thing is particularly important when implementing a new wellness program within your business. You'll want to offer programs that can be used and seen as a benefit to improve the health and well-being of your particular workforce. When an employee needs to take a mental health day, time off to do some much needed self-care, or if they wish to participate in any of your company wellness offerings, leaders should respect and encourage the employee to do so. And the best way to handle this is to be prepared ahead of time and have plans already set in place for when employee coverage is needed for either shorter or longer periods of time. Lastly, try to create the least amount of barriers for employees to access any of these health and wellness programs that your company is offering. And on this final slide here, Northern Light Health offers several programs to support the health and wellness of their employees. So here's some more information on how to reach out to these different resources. Thank you, Karen.
Thank you so much, Annika. And you'll notice there that Workforce EAP is listed. And Cheryl mentioned in the chat there that Strengthen Me program is available for free for employers across the state of Maine. So thank you, Cheryl, for sharing that. And Workforce is the entry point that we offer today to access that resource for employers. So, and Sheila's providing more information. So wonderful. Thank you so much. So as we move into our question and answer portion of today's conference, I'll ask our panelists to turn on their cameras and again encourage you all to ask your questions using the question and answer feature of the tool that we're using today. I do notice we've had several questions already come in that panelists did write written answers for, so thank you to our panelists for getting us a jump start. I'll start off by asking Dr. Gilkey the first question today. Dr. Gilkey, in recent news reports, we are hearing of another variant called Deltacron. What can you share for information about this variant, and is there cause for concern?
So talk about cutting edge information. That information was just released over the last week. So Deltacron actually was described out of a laboratory in the country of Cyprus, where they recognized that the genetic material they were seeing was from Delta as well as Omicron. And biologically, that combination can occur. So if you think about it in the worst case scenario, it would take the worst of Delta, which is causing severe illness and death, and the worst of Omicron, which is causing high transmissibility, like we couldn't even fathom when we went into Delta with its transmissibility. Putting those features together into one organism to infect the world further. The good news is, as the peer review work was being done around the world looking scientifically at this data, it was discovered that, in fact, the information came from contamination of laboratory specimens rather than the true biologic combination of the two. And just to kind of give us a little bit more peace of mind, if you think about all of the genetic material in each of those variants and selecting out just the parts that do the worst things to humans, statistically, that's not very likely to happen. So the concept of that superbug, Deltacron, while technically it could occur, the likelihood is extremely remote. So I don't think I'm going to spend much time worrying about Deltacron.
Well, that's good news. I appreciate hearing that for sure. Catherine, I'm going to ask the next question of you, and it was actually prompted by one of the questions that was asked on our chat feature, which was what resources are available to help teachers. And when I think about teachers, I also think about other professions who are really, it's all about caring for other people. So healthcare workers obviously was top of mind as well. And given your role at Northern Light Health, I'm sure you can empathize with the struggle of promoting self-care to employees who are spending all day caring for others. And it is a very difficult dilemma because that care for others doesn't stop, that doesn't take a break. And so do you have any recommendations for leaders in education and other professions that really have staff dedicated to care for others, how they might be able to promote self-care to their employees? And I'll ask you first, and then I'm certainly going to ask Angela and Annika if they have anything else they'd like to add to that.
Sure. So I'm not sure what the educators in Maine have access to. It was my understanding at one point that there was an employee assistance program available to teachers in Maine, but that was several years ago when I was in a different position. So I want to say up front, I'm not exactly sure what the resources are, but I think, the teachers that I know, so the struggle is real. I think that's pretty much uncontested at this point. And so to my mind, as much of a sense of community that can be created and people, again, acknowledging what's hard and then talking about sort of how are people figuring this out. And, we want to remember that something that works for one person may not work for someone else. I had a conversation with a good friend last night who's a leader in New York in the city. She runs an organization, and where there's a lot of burnout right now, and she's certainly experiencing it. And she said, and I say this with all due respect, I'm so tired of people telling me to get enough sleep and drink water and exercise, because if one more person tells me to do that, I may punch them in the throat. And I totally get what she's saying, because as much as those things are important, and I would be the first one to say, I think what can happen is that what we're not doing can become another distressor for us, right? I'm supposed to do all these things to take care of myself, and today I did none of them, and therefore, like, I'm a complete failure. It's another thing. So I think really being able to focus on the wins. What did I do today that was helpful? Did I take 5 minutes for myself to do whatever it is that works for me, and celebrating that rather than focusing on what didn't get done can make a really big difference.
Angela or Annika, do either of you have additional thoughts? That certainly provoked some thoughts for me.
Yeah, definitely. Interestingly enough, my husband is actually a teacher, so they do have access to EAP. I know that they do through the Maine Educators Association. I totally agree, Catherine. I was chuckling a little bit, right? Because you're right. It's not enough to tell people, yes, get more sleep and drink more water. One of the things I know just has been actually helpful for him as a teacher is continuing the camaraderie with the other teachers in his department and the other teachers in his building. So having that opportunity to get together with them, albeit virtually or fully masked, just to have that camaraderie and to let off steam has been tremendously helpful. So that's something that I know firsthand has actually worked for him.
Yeah.
Like I thought I would have for teachers.
And Annika, I appreciate the fact when you were presenting, you were really giving some examples of things that I felt were doable and not overwhelming to get started. I think sometimes when we think self-care, we think I have to get on my bike for 30 minutes and I would punch somebody in the throat if I had to do that, right, Catherine? I really appreciate your approach to the presentation there. But Annika, starting the routine is one thing, sustaining routine is another. And oftentimes when we're dealing with all of these other stressors, what we started oftentimes can fall to the wayside, and it's even more difficult to get started because we're disappointed in ourselves. So what are your thoughts around that? Do you have any suggestions?
Yes, I mean, I think what, Catherine bringing that up is an excellent point of feeling that guilt or shame that you're not doing everything on that list perfectly all the time. So giving yourself some space for forgiveness, and noting those little wins and celebrating the little wins of what you did do. And in terms of when you do fall off and you find yourself feeling guilty about not doing enough, having some support, to somebody to talk to acknowledge out loud what you are feeling goes a long way, and somebody to also help motivate you to get you back on track for whatever you're working on. One thing at a time, small chunks. You've got your whole life to be getting a routine in some of these self-care activities, so it's not about winning a race.
Yes, I appreciate all of you contributing to that conversation. It's so important. Those relationships, right, that Catherine spoke of are so important. I do want to have some time to ask Dr. Gilkey some of the questions that are coming in around COVID. Dr. Gilkey, can you help us navigate the changing guidance around masking? People were doing cloth masks. Now there's some discussion about doing surgical with a cloth over. There's discussion about everybody should be wearing, N95s. Let's kind of give us some clarity on that, please.
Okay, well, that certainly is a fascinating subject. I'm going to start off by saying it's highly likely that everyone who's not extremely isolated in the United States will be exposed to Omicron or be infected by Omicron within the next 3 months. I think that's going to hold true for the world over the next 6 months. So Omicron is so good at getting access to humans. I think it's inevitable. So then why put in any effort becomes the question, right? Why vaccinate? Why boosters? Why masks? Why try? Well, what we're trying to do is for those that are getting severely ill, with the masks, we can prevent that transmission to some degree and slow it down so that we're not getting that huge spike that's overwhelming all of our systems and everything. I think that's an important part. So let's talk about what that looks like. Properly fitting masks. I think if you're going to go out and purchase a mask specifically for that, a KN95 is a good place to start. A more advanced mask is an N95, both of which you can get. I think that the cloth mask days should be gone because they really are not going to achieve it with Omicron and the ability to inhale it because it is airborne. Remember, like a year and a half ago, we were talking about aerosolized. This is airborne, so let's call it what it is. I would recommend considering KN95s, and you can use cloth over it. So the way to really look at it, first off, about 60% of the masks coming in from overseas are false advertising, I'm learning. So really look for Made in USA if you could get it. Then look at 3 layers. If you have 3 layers, you're likely to be able to contain the viral particles external to you. And for you, in the event that you're asymptomatic and potentially a spreader, you won't be spreading it as effectively. So those are the 2 things. And then I would reinforce the idea that Omicron is a very severe, serious illness that can occur. The numbers are a little bit different than Delta and the previous ones, but nonetheless, there are going to be a lot of people dying from this. So let's keep it taking seriously. Try not to get it for as long as people can. And our best bet really truly is vaccination and boosters to prevent falling in the category of severely ill. So that's my whole take on a complicated situation.
It is complicated, so I appreciate that. It was very helpful. There is one question, Dr. Gilkey, any place locally that sells N95s you're aware of, or KN95s, I should say?
I'm not tuned into that because we have supply chain managers, so I'm not in a position to actually answer that. I would definitely contact the big box drugstore chains, and see what they have available. There's other medical supply issuers that are out there. And there was another component to that question. Let me just
Are they reusable?
The KN95 are reusable. So what you could do is you could wash it out and then let it dry out and reuse it. That also reminds me, another way to know if your mask is useful is hold it underneath a faucet, fill it with water, and if water doesn't get through, it's useful to you.
Great. That's a helpful hint. Thank you, Dr. Gilkey.
Mm-hmm.
Catherine, I think we don't have a lot of time left. So much information shared today. So I'm going to pose this question to you with the intent that it might be our last question. So there's a little pressure for it to be a good answer, Catherine. But I think this is a good one. So once an employee reaches a breaking point where burnout is real, is there any way to truly turn things around, get back to the way things were? I think some of us are feeling it. We wake up in the morning and we've lost hope that we're going to feel it, that sense of inspiration for our work and passion for our work that we once felt.
So yes, the answer is yes. Sorry.
Well, that's a great answer.
That's my answer. Yes, absolutely. No, yes. I mean, I think that most of us have experienced some element of this in some areas of our life, and then hopefully have been able to turn that around. And we are as a species, we're super resilient. So this is the good news. But it certainly is easier to do that sooner rather than later. And I think that's the really important piece, is checking in with ourselves and with our employees. And trying to address it as soon as possible rather than letting it go on until it becomes a real crisis.
Thank you so much. That is a great answer, gives us hope. because I think we're all feeling it a time or two, and staying connected and having those relationships and conversations is so critical. So thank you so much. Thank you all for joining us, and a special thank you to the panelists today. Just a reminder, you can find recordings of all of our Zoom conferences, including today's, on our Northern Light Health website. We did provide the link in the chat as well. I hope this hour has been a help to support you, your employees, and our communities. Just a reminder, we will be emailing you a survey right after our conference today. Please be sure to give us your feedback so we can continue to provide you with relevant information. Our next session will be on January 27th, when we will provide the latest on COVID-19 and discuss mental health fatigue and strategies for building on your team's strength. We will send you the link of this session, and we encourage you to share the invitation with your friends, colleagues, and others who might benefit. We certainly hope you are able to join us. By working together, we will keep Maine safe. Thank you, and have a wonderful afternoon.